Who are you?
I'm Lisa Suennen. I'm managing member and partner at Psilos Group, which is a healthcare venture fund. We invest in companies that improve the healthcare economy.
Yeah. You're the first healthcare venture capitalist I've interviewed probably ever.
I'm sorry.
No, but I was interested in the field because 20% of our GDP goes in this field, and it seems like it's getting hotter and hotter. I've interviewed Hippocrates and have watched some of the mobile apps come along and seen some of the startups like at Techstars that have been in the healthcare field. So I wanted to find out what's happening in the field from your point of view.
Well, it's a pretty active field right now. It's interesting. I think there's a lot more interest in it lately among the mass public than there has been in the past because of the healthcare legislation that passed earlier this year. It's a field that I'm surprised that more people don't spend time thinking about because it does make up 20% of our economy, and it's estimated to go to 40 if we don't change the way costs are expanding in healthcare. And so we focus actually our energy as a firm on finding companies that can reduce the inflationary trend of healthcare. So companies that improve quality of care and reduce the cost of care. And for us, that's the only way to really tackle the problems that we're facing economically.
How do you do that? How do you reduce cost?
It's funny, a lot of people think that good healthcare equals more expensive healthcare, but it really couldn't be further from the truth. There's massive variations of what things cost, even for the same procedure within the country. And there's an incredible amount of waste and error in the medical system. And about 85% of all costs, depending on who you ask, 85% relate to the treatment of chronic illness specifically. So you can do a lot of things. You can improve the way people do medicine so they don't make as many errors, which costs somewhere between $20 and $40 billion a year. You can prevent many chronic illnesses like diabetes, which are completely preventable, and save untold billions of dollars, or at least catch them early so you can treat them more effectively. Yep. You can improve administrative processes. Healthcare doesn't have technology in use the way financial systems and other manufacturing, other industries do. Healthcare is barely penetrated with technology, so you can make dramatic efficiencies. There's a lot of things you can do to improve healthcare costs.
Can you tell me about some of the companies you're seeing that are doing interesting things?
Sure. Well, for instance, on the medical error side and the reduction of errors, there's a company called PatientSafe Solutions, which is in San Diego, and they have a handheld, it's a mobile device, like you're talking about. Mobile healthcare is pretty hot right now. Well. Yeah. A lot of people, when they think about mobile healthcare, they think about consumer applications, but this is an enterprise application, and it's for hospitals to avoid making medication and other types of errors at the bedside. So if you're a patient and you go into the hospital, beware, because the odds of you getting injured by the acts, unintentional acts of doctors and nurses is unfortunately quite high. About 20% of all medications administered in hospitals are administered in error. And they're not all errors that cause death or dramatic injury. Some of them are just, it's late or, whatever. But sometimes they're really serious, wrong dose, wrong patient, what have you. And so this is a handheld product that the nurse carries to the bedside, and it's an iPod touch device application. And they have added a barcode to it, barcode reader to a special barcode reader, and it automatically wirelessly reads the information that comes out of the hospital's pharmacy system. And it tells you, the nurse, while you're standing at the bedside, this patient who you've now barcoded their wristband, because they all wear barcoded wristbands, this patient gets these medicines in these doses at these times, etc. And then you take the medicine out of the cart and you scan the medicine. They're all barcoded too. And it tells you, oops, not the right one. Or yes, this is the right one, go ahead and give it. Or it'll tell you, what type of situation that might lead to an allergy, what have you, if you mix this or that. So it tells you right at the point of care if you're about to make a mistake. And it's actually been shown at hospitals that have this. There are about 92 hospitals now that have this operating, that they can go from an error rate of 19–20% to 0.
Wow. It probably also keeps drug interaction mistakes down.
Exactly. Right? It tells you exactly that type.
Especially if you're a cardiac patient, they probably have 20 different drugs that they're getting fed. Yeah,
so that is often caught at the pharmacy level in the hospital, but if it's not, it would be caught there. But that's a good issue to raise, because that happens outside of the hospital more frequently. Yeah. So outside of the hospital, there are products, and we've invested in them as well, where it looks through all of the claims and medicines and things that you're taking. It takes a live feed off of your CVS or Medco or what have you, pharmaceutical prescription, documentation that comes in through many different systems, from many different doctors and from many different pharmacies, sometimes for the same person. And it looks exactly for that, and it finds interactions that would be detrimental, and it'll, they'll call a doctor and say, hey, are you aware that a patient could be injured by the fact that 2 doctors are prescribing contraindicated medications? There was a company called Active Health that we funded. We were the lead investors on. We actually sold it for over $450 million to Aetna. It did exactly that. And we have another company called Health Edge now, sort of next generation, finding those types of mistakes.
Interesting. Rocky and I were just at Stanford University visiting their robotics, medical robotics labs that they have there. Pretty incredible stuff. Are you looking at new kinds of robots to do things like new kinds of surgeries, stuff like that?
Well, we haven't been looking at the robots themselves. They are amazing. But we do have a company or a couple companies that have worked at the the working end of the robot. So the robot allows you to manipulate tools, but the tools in the end are critically important to the outcome. So we have a company called OmniGuide in our portfolio that has a CO2 laser surgical device. It's a surgical laser. And one of the things that's super cool about it, aside from the fact that it was invented by this amazing guy at MIT that's invented all sorts of amazing things, is CO2 laser energy, when you use it in the body, evaporates immediately on touching water. So it really only hits the cell you're aiming at. All the other kinds of lasers that they use to do surgery in the body create collateral damage. So if you think about it, you shoot a laser, like one of those laser pointers at your hand, and you could see in through your skin. Well, that's actually happening. It's actually touching those other cells behind. So when you're doing surgery near fine structures like the carotids or the prostate or what have you, lasers can be dangerous because they can cause damage, fry tissue you're not supposed to fry.
Yeah.
So this CO2 laser doesn't do that. Basically, it doesn't cause that kind of collateral damage, but nobody had figured out a way to create a minimally invasive product, surgical product, to go into those fine structures of the body without cutting you too far open. Wow. And this guy figured that out. So they've got a surgical laser scalpel that goes at the end of the robot, so you can manipulate and do these fine surgeries often much faster and often with much lower side effect profile. So it's very cool.
What kinds of companies are you hoping walk through your door in the next year?
Well, ones that'll make us a lot of money, but especially looking for things that fit really well into the healthcare reform environment. Whether this healthcare reform law stands or not, we got to reform healthcare. We just cannot go on like this as a country. We can't sustain it economically. And if you look at what they're trying to do in the government already pays for 50% of healthcare. So they're trying to, a lot of initiatives at the federal level and also at the state levels to figure out new types of insurance products and programs, new ways of engaging consumers in their own healthcare. They've shown that if people know what things cost and understand the choices they have, they often make the less expensive choice, which can often be the clinically a more appropriate choice. We're looking for things that continue to reduce medical errors, like we talked about. Just really anything that in the medical device area that has a way of doing an existing procedure but less expensively with lower impact on the body, lower negative impact on the body. So we're taking open procedures and making them minimally invasive or endoscopic, for instance. Those types of things.
Yeah. Is California the only place to invest in, or are you seeing innovation in this field worldwide? Or
California is not the only place to invest for sure in healthcare. It's not. It's funny. It's not centralized here like it is for so much tech. So it's not just San Francisco and Boston. We actually have investments all over the country, and even one in Paris, which unfortunately I don't get to go to.
We're just there.
Yeah, I wish my partner got that one. Anyways, but it's really pretty spread out. I mean, there's concentrations in certain areas, but we have companies in Florida, New York, and Albuquerque, and California. I think to your question about innovation, it's interesting. In the medical device world, California has been very dominant, although Boston and Minneapolis are also big areas for medical devices. But there's a lot of people who believe, and I guess I probably am among them, that recent regulatory acts and complications in getting through the FDA and difficulties in getting reimbursement in the insurance system are sending a lot of innovation maybe out of the country. And it's an area. It's an area of concern because I think it's a market that we have owned, completely owned, for many, many, many years as the United States. And if we are, sending sort of anti-competitive regulations out into the world, it's going to be hard to sustain that over the long term.
Yeah. What about innovation in understanding the genome and genes? I just took a test from 23andMe, right? So that it comes back and says, oh, you might get this cancer later in life.
Yeah.
You have a marker that...
Feel better now?
No. I haven't done it. I'll tell you next week. Are you seeing new kinds of ideas and new kinds of companies now that the cost of doing genome research is coming down?
This is certainly an area there's a lot of activity, and there's particularly in diagnostic testing. We don't really look at this area much, and we don't because by and large, this is an area that doesn't contribute to improving healthcare costs. It generally, so far, it mostly contributes to increasing healthcare costs.
Okay.
Because the fact that you know that you might get Parkinson's someday, which, by the way, having the gene for it doesn't necessarily mean you're going to get Parkinson's. Nope. So there's a real question as to the validity of some of the information, or value of some of the information. Say it might be valid, but is it valuable? I don't know, because it depends on so many other interactive effects of genes and environment. But by and large, the genomic activity that's out there, with rare exception, isn't contributing to improving our overall economic profile in healthcare yet. It might someday. If you can truly personalize medicine, so you don't give people drugs that don't work on them, yep. That's a cost savings opportunity. But there's only really a couple of companies that have proven that so far.
Yeah.
And it's really outside of our scope for the most part.
Yeah. I just walked through the Computer History Museum with Steve Wozniak, and he walked us through the history of computing, and there was some real key turning points that you could see. Mm-hmm. Where the defense industry developed integrated circuits, for instance,
right.
And that made the personal computer possible. Are you seeing that kind of outside influence? Like, for instance, our cell phones now have really good small cameras with really nice flashes or nice lights on them.
I think that whole area of mobile technology, and particularly some of the work that Apple's done, is really going to change healthcare IT, and is starting to already. Because healthcare IT has been so antiquated for so long. I mean, it's dominated by very few companies, and they're using ancient technologies, some of these companies, all of these companies. And the hospitals and the insurance companies that run our healthcare system run off of, systems that are 20, 30 years old. Yeah. And it's very difficult for them to switch out those installed bases. But if you come in with mobile technology and you can integrate back to some of these things, you can add new applications and make it accessible at the bedside where really it matters a lot. And so you're starting to see that happen. You're starting to see, particularly in hospitals, you're starting to see, these iPod and iPad types of applications pop up. I read somewhere, I don't know if it's accurate, but I think I read that medical applications are one of the biggest applications that have been written for the iPad so far. And that doesn't surprise me because, when you put them in the hands of nurses and doctors, they love them because they are so used to using Flintstone style, birds chipping at stone kind of tablets.
Well, at Stanford they have cows, right?
Yeah,
which are these big
computers on wheels.
Computers on wheels.
That weigh 125 pounds. The nurses can barely push them down the halls.
Yeah.
Yeah.
And so they don't get used, or they don't get used in the way an iPad kind of app.
They get worked around, actually. They get worked around. They literally leave them in the hallway. So for instance, I talked about PatientSafe Solutions, the barcoding medical management software. They use cows for that same thing. And what happens is the nurse can't push it into the room because have you walked into a hospital room? You can barely get by the bed, right? Can't push these things around. So the nurse barcodes the med outside the room, maybe, goes into the room, not at the bedside, so you can't barcode the patient. Yep. So you make a mistake, and they go back out and they say, oh yeah, okay, I did this, but they're not doing it literally at the point of care. And so there's mistakes that get made. It's problematic.
Interesting. Well, cool. Do you have a blog where you talk about some of the things? Or?
Yeah, I have a blog called Venture Valkyrie. Yeah. I write usually once or twice a week on various healthcare or venture topics. It's created a lot of opportunity to speak to people I didn't normally get to speak to. I'm always amazed that people actually come and read this stuff. But I found it to be great, in terms of getting our thoughts as a firm out there, my thoughts as a person out there, and creating the opportunity to meet new and different people in the healthcare area.
Very cool.
Yeah.
Well, thanks for what you do, and
Yeah,
we'll
thank
be
you.
watching to see can you reduce our healthcare costs, because as I get older and as I have kids, it's becoming a big, big problem for us.
Yeah, it is, and but you know, there's a real opportunity to make a difference, but I think we all have to be vigilant about caring about it and paying attention to it, both in terms of prevention on the healthcare side and also in terms of intervention. So, thank you very much.
Thanks.
Nice to meet you.